to answer this question. How much is this going to cost? When will this be done? Like even ballpark.
Well, two ballparks there. We're not sure exactly how much it costs yet because obviously we've not done a lot of work. We are going to get $500 million from government, and we estimate we'll at least have to match that to make this a reality. The time frame, we're estimating that this will take us about 7 years at this point in time, so 2022 for opening day. That's our best estimates today.
To match that 500, does that include selling off the current property?
There'll be no decisions yet whether we're selling land or not. What we do know is we have to leverage the current lands to enable us to get to the $500 million. So maybe leases, who knows? That work's still to be done.
And by leveraging land, you also include Mount St. Joseph's Hospital. Can you tell us what the future of that hospital is?
Because this is going to take a clinical conversation across all of Providence Healthcare's facilities, we're going to have to talk about what's the best care for all of our patients. So we'll be discussing at Mount St. Joseph's at the same time to determine really what is the best answer for that site as well. Should it be part of this conversation? Should it be part of this project? Or are there other solutions? We will deal with that working with our physicians and our communities.
So it's possible you could move that hospital to the new Station Street site then?
Certainly we're having a conversation which might include that, yes.
Sorry. As you can understand, Vancouver residents have been on this roller coaster where we've, heard about plans for St. Paul's revitalization, moving, revitalization. What makes this announcement different from sort of the announcements that have been made over the past few years? And when did the discussions begin to really consider moving the hospital as opposed to the revitalization that was talked about 2.5 years ago?
Well, our discussions with the Minister of Health began just before the end of the year when we were able to have conversations which developed into an understanding of the Ministry's care development plan, if I can call it that, which enabled us to think about core hospitals, other facilities aligned, connected, that enabled us to align with the Ministry's process and provide the right care. This plan is different because of that, and also because when we looked at Station Street earlier back in 2003, 4, 5, and 6, it was about replicating the services we had at St. Paul's. This is not about that. This is about providing a different opportunity to look after all of the patients and look after their care from birth to death, virtually.
Can I just add to that, maybe? I'd say there's three things that make this plan different from previous. So as Neil said, it's now the opportunity to understand a new vision that the Ministry of Health has brought forward and that there's complete alignment with that vision. The second is that we've had the opportunity to do very detailed work around the current Burrard site, and at the conclusion of that determined that that was not a good solution for now or go forward. And the third, I would say, would be the fact that we've had enough opportunity to do analysis of the value behind the property that we can leverage to know that we're in the right ballpark to be able to bring forward the support that we need. So, yeah.
Two questions, if I may. What happened with the current St. Paul site, A, and B, will there be kind of medical facility for the West End people or the city center people managed or owned by Providence?
Yes, it's important to understand that we will have conversations with the West End population to determine, as was stated earlier, just exactly what care they need to have in the West End for them. Whether that's at the St. Paul's site or in other clinics or situations in the West End, yet to be determined.
So can you guarantee that there will be some kind of emergency services for the West End?
Well, there will always be emergency services for the West End, and the best way to handle an emergency is to dial 911. Because even if you live in the West End, the best hospital for you might not be St. Paul's, because Vancouver General might be the best hospital to go to, and the paramedics will determine that. So those services will always be there. What we are talking about is having a conversation with the West End about what primary care needs do they actually have that we can substantiate and supply.
Well, I think you understand my question. Will there actually be a physical type of ER in the West End somewhere? Jeff Plant said that there
No.
will be some services left in the West End.
Yes.
What can you guarantee as a bare minimum for West End residents physically in the West End?
Well, the bare minimum will be that we'll have the right conversation to get them the right space in the right place. There will be no ER per se, as the way you understand an ER. I think the data that Darlene showed up there showed that 19% of the ER visits to St. Paul's come from the West End, but 80% of these visits are actually non-urgent. So only a very small percentage are truly ER. And so what we're trying to do as we move forward into the future is only have the ERs and the ER in our site look after those patients who are truly emergent. And those who do not need emergency care will be able to go to, at our new site, a primary care facility, which will deal with what we call the CTAS 4s and 5s.
Maybe Dan could.
Dan?
Yeah, just to pick up on Neil's
Yeah.
Sorry. Just to pick up on Neil's point, I mean, obviously, this site is a little further from the West End, but when you talk about accessibility, if you have a new state-of-the-art facility that has accessibility at all entrances, that has services connected by proximity, that helps a lot, especially with our frail elderly population. Getting there is usually not the problem with ambulance or taxi. It's inside the hospital how important it is to move around at the continuous services. So this could potentially be an advantage to many of our disabled patients.
Dr. Callum, maybe stay for a second. Pamela, you had a question?
I did, yes. Mr. McConnell, can you tell us what the exact distance is by car and by ambulance in terms of distance and time to the new site? That's my first question. And yes. And the second question is everything going to be demolished on the St. Paul's site? I don't know if the facade is on any sort of historic list, but that I think is the most precious part of it historically.
So I don't know if anyone heard the question or not, but there were two questions. One about distance from St. Paul's to the Station Street site, which it's around a 10-minute drive, so it's about 2 or 3 K. I guess there's different routes you could take, but that's approximately right. And while I'm going through that, answering that question, the Station Street site has got greater accessibility for the city of Vancouver, for residents. It obviously has the train site, the light rail transit site. You know, it's an easy site to get to. And in terms of, and your second question again, sorry?
Demolition.
Demolition, yes. There will be demolition on the St. Paul's site. There is a historical component to that site, and we have to continue our discussions with Vancouver to determine exactly how much of these historical buildings need to be retained. There's a 1912 block there, which is pretty significant, and I think might well be a component which should be retained.
You said that you looked at the value of the land at the Burrard Street site. How much do you, who said that? I can't remember. How much could you sell that land for? 6 acres, prime downtown land?
You know, that work is going on at this point in time, and so I don't have a good answer for that. What I do know is what's on the public record, let's say, that land is currently assessed at around $360 million. Now, so that's a part. The rest of the conversations will be proceeding as our teams look at how best to develop that site. And let's not forget, we have to have ongoing conversations with the City of Vancouver and all of these contemplations.
I don't know who wants to answer this, perhaps Ms. Doyle. In June of 2012, the health minister of the day, made an announcement that looked and sounded much like this one, $1 billion redevelopment and expansion of Royal Columbian Hospital. It's almost 3 years later, and there's no sign of shovels in the ground. Why are you confident that your plan will actually go ahead?
Well, again, the difference from that announcement to now is that we did very detailed work as requested by the ministry, to look at what would the solution on the Burrard site bring, and it was not a good solution every way you look at it in terms of the economics. So we did detailed work the best we could do while we keep all the operations going, because we need to do that, was to build a state-of-the-art ambulatory care center and do some minor refitting within the inpatient component of the Burrard and Providence Towers. So at the end of detailed work where we engaged community and we engaged our physicians and our care providers, we came up with a solution that wasn't a good one. So the cost was not it was not good value for money. We didn't end up with improvements really in the inpatient component and not much of an increase in the private rooms, which are so important for the prevention of infections. And we didn't have, at that point in time, the same vision for a transformed healthcare system that we now have from the Ministry of Health that this so aligns with. So.
But it still hinges on a finalized business case.
Pardon me?
This plan still hinges on a finalized business case.
Correct. Correct, because there still is a need to go out and take the concepts that have been developed and engage all of the individuals that still need to be engaged to take it from concept to a completed business case. Yeah. So did you want to add?
I was just going to add to that question. When the teams moved forward and looked at how much could be done or what can be done with the St. Paul site, there's one factor that always sticks with me as being one of the very most significant, and that is the whole world is looking at the provision of maximum single patient rooms, because the research out there points to the fact that this is the right way to go. We have the capability to get to 100% single rooms at the Station Street site. The St. Paul site can only get to about 48% single rooms. So you're committing yourself forever to a solution that is less than ideal today.
When we were talking, the first time we were talking about this location close to the train station, Providence, neither Providence nor St. Paul had been able to convince the West Ender and the Vancouver Society in general that the hospital is located in the West End, but it's not a West End hospital. It's an old BC hospital for people with AIDS. It's an old BC hospital for people with kidney problem or heart problem. Are you confident that with the stats that you have been issued this morning, you're going to be able to convince the Vancouver Society that this hospital is a province-wide hospital and not a West End hospital, even if it's located in the West End? Am I clear enough?
This is a hospital for everyone. It's a hospital for the West End as well as it is a hospital for the rest of the province. And I think all of our physicians here deal with patients from the West End and from the rest of the province. And so, Dr. Sim.
Just to reinforce the notion that St. Paul's Hospital does not just serve the West End or the downtown core. In fact, if you look at the ambulatory, in the ambulatory setting, more than 70% of the patients who come to St. Paul's are outside of this core region, and 50% come outside of the Greater Vancouver region. So we service all of residents of British Columbia. And the other thing I think you ought to know is because of our physical capacity, we are constrained in very material way the number of patients that we can see in a given year. And this is one of the reasons why access is so difficult, not just at St. Paul's, but throughout British Columbia for specialists. And without a renewal of a physical capacity like the renewal that's been proposed, the wait time for specialists, wait time to see physicians will, in our estimation, double by the year 2020. So this is critical to ensure that residents of British Columbia get access, great access, in a timely fashion.
Bill. Dr. Don Sim, and then we have Dr. Leo Montana.
Look, this is the biggest concern that has been expressed again and again, and that's sort of the support of the West End. We are all emotionally attached to the West End. We have a long tradition of serving the West End. My program, the HIV program and the addiction program that work so closely together, has probably one of the strongest connections to the West End and the downtown East Side. So when I was offered to examine this plan, the first thing that I honestly had to ask is, what are we going to do with the West End? And the reality is that we're moving a few blocks away. I mean, really, it's not like we're going to another continent, number one. Number two is that there are transit options that will make the West End very close to this site. And if you look at the map that was shown earlier, which you probably we should put it back, the downtown East Side actually is very close to this site. Not only very close, but with very direct access to this site. Having said that, we, in our program at least, we have moved our services radically into the community already. We are operating within the community. The model that Stephen Brown, the Deputy Minister, and the Ministry itself is embracing is nothing but a reaffirmation of the model that we have brought forward, which is bringing the services to the people where they are and repurposing the acute care services for those that actually need acute care services, for whom an additional 10-minute drive is really not an issue. So my program, as the hospital, will remain committed to support these communities. But the truth is, the space that we currently have at St. Paul's is inappropriate. We've been working under suboptimal conditions for a very long time, doing very, very good work, but really in a very suboptimal setting. And as it has been said, we cannot plan for the rest of our life. Listen, I'm going to use the new site. I'm not going to do research in the new site. And I want a private room because the state of the art says that private room is the only way to go. So I don't want it any other way for myself, for my family, for my patients, and for my colleagues.
Young, you had a follow-up question, but we also have Dr. McEwen, so maybe you want to ask it.
Well, you said you're not sure how much this will cost. How can you sell this to taxpayers if you don't know how much it'll cost? How do they know they're getting value then?
Well, I know it's going to cost around $1 million. I just don't know exactly how, $1 billion. I just don't know. I just don't know exactly how much at this point in time, because obviously there's a lot of work to do here before we can determine exactly. But I know if we're talking about 1 million square feet, that's give or take $1 billion. Pardon me? Well, yeah, indeed. The important thing is that government was going to give Providence $500 million, no matter which site they're on. So it's not going to cost the public any more money to go to Station Street than it would have to be at the Burrard site. So it's a real bonus in a way for the public to get Providence Healthcare to add $500,000 to enable this facility to happen, $500 million to enable this facility to happen.
I also wouldn't want to leave the impression that although we haven't yet been out and engaging all the people that we need, that to date, in the last 4 months in particular, that we haven't been doing some very detailed work. We have brought in world experts to look at both the design and the cost behind that design, as well as other experts that have looked at the value that is behind the land assets that we can leverage to bring this forward. So we've got tons of work to do still, but it's not that this concept and announcement that we brought forward today has not had some world experts looking at it and giving us the confidence that it's the right solution and an affordable solution.
Hi, you keep talking about this as a proposal, as in development. Given all the false starts, when can we actually be assured that this project is happening? We've talked about it for so long in various forms with nothing. So when can we say confidently, yes, this is happening?
Well, we have to produce and complete a business case, and I think that will take us approximately 12 months. And that would be the next major step in this project.
Hi, Diane, do you start fundraising from the private sector tomorrow for this? And what do you hope to raise? And secondly, is there a possibility that Burnaby may be enveloped in this whole plan, since the government has been talking about the wisdom of moving Burnaby Hospital into VCH?
Yep. So first, the donor community. We have in the audience Dick Villette. Dick is the CEO of the St. Paul's Hospital Foundation. We do know in speaking to donors to date that there's a lot more excitement about the opportunity to build on Station Street site than we were able to generate in terms of support for a rebuild on the current site. But the Foundation will be doing their detailed planning and doing an official launch to get all of the donor community involved and engaged. So I wouldn't want to preempt their official launch, but suffice it to say that they have been in conversation with some significant donors. So we know that we will have support there. Burnaby Hospital. So we know that Burnaby Hospital shares some patient flow. The boundaries that we set for health authorities are somewhat permeable. Patients flow between those boundaries. We have had patients from Burnaby that are served at our Mount St. Joseph and our St. Paul's, and in fact at VGH sites. So I couldn't speak to what ministry is planning for Burnaby Hospital. What I would say, though, generally there's such an exciting opportunity on the Station Street site to look at whatever is a right solution for whichever patient populations around the province, because only a little more than a third of the property that we have access to on the Station Street site will be utilized for the build that we've announced. So future opportunities for other healthcare solutions are available on that site, but I couldn't speculate what other hospitals or health organizations' needs might be met through looking at that future vision.
All right, so sorry to belabor this point, but I understand the talks have been going on now for 4 months. That was when it was sort of seriously looked at that this was the proposal. So what happened, if you can explain, between the middle of 2012 and 4 months ago? You know, I keep on hearing that this work hasn't gone to waste, that this information will be used. But now, you know, almost 3 years ago, we were told we're doing a business case for this. 2.5 years later, you say that, you know, officially going to change that. What happened in that 2.5 years?
I'm not sure how many ways that we can articulate this. There was very detailed planning that happened. We engaged our care providers. We gave it our best shot. What would the development of St. Paul's look like on the current Burrard site? And
Why then
sorry.
was that announcement made? Like why then was that announcement made 2.5 years ago about revitalizing it without serious work being done? The Premier made that announcement herself. Why did that happen?
well, there was a request from the then Minister of Health, to provide the detailed business case, and that's the work that we did. And that business case, as a result of that direction, was found not to be something that is defensible from an economic or a clinical point of view. Neil, did you have something else?
Thanks, Dave. Maybe I just start off with a couple of points going back to the populations we serve. As I think many of you saw in the graphs that you'll get later on, 21% of the people who come to our emergency department come from the downtown east side. It's the area that I've got a love of. I've worked there for 15 years. And so the concept of can we treat those people better is really important to us. The other part, though, is when you think of that, we have a lot of people in the West End we have not been able to serve as well as I would like, certainly within mental health and addiction. We have a lot of people who are needing care for moderate and mild kinds of depressions, anxiety, addictions, and other psychiatric problems, which are not able to get the treatment they should have. And this is going to allow us to do this. You look at our emergency department, Dr. Kala's emergency department, in which they have had a huge increase, 88% of increase in the number of people who are being treated for mental health and addiction in their emergency every year. We're up to almost 10,500 visits a year. This takes away from us being able to do anything else. So I think this is really a neat opportunity in terms of those populations, that we can serve the West End way better, as well as the downtown east side.
Well said. Perhaps Dr. Wood would also like to share a little bit on the addiction side.
Yeah, I just, listening to the conversation, it has been a long conversation, as Julio alluded to in his remarks. And I think from a clinical perspective, those of us that work in St. Paul's, the whole conversation about redeveloping of that site, we were all just like, how can we possibly do this? And really what we're talking about is a needs-based planning with this incredible opportunity that we have this space. I was telling my wife this morning, we have a huge, vast, empty lot in the middle of our city, and it just creates an incredible opportunity for us now. So as it stands at St. Paul's now, the facilities are to some extent crumbling around us and our patients, and it's simply not sustainable to be able to meet their needs while doing a renovation on that site. So it's incredibly exciting from a clinical perspective. I think we're all thrilled at this opportunity. I think we've all thought long and hard about the West End and aren't actually that anxious about being able to meet the needs that will persist there. I don't want to speak too much about addiction, but because I know that my colleagues from every single department within the hospital are struggling for space. But for some of the new disciplines like addiction, we're butting up against a system where there's no room to grow and there's huge patient needs. So from our perspective, the co-location near the downtown east side is just a huge opportunity that I think will benefit not just the population struggling with addiction, but all British Columbians. So it simply does not seem possible to do what we need to do at St. Paul's, and really excited about the change.
I guess the other thing is, this announcement is about a capital plan because St. Paul's does need renewal, and we have the opportunity to build a wonderful state-of-the-art facility on the Station Street site. But the announcement is more than just a capital plan. It is about the opportunity to create a new model of healthcare delivery that includes services not only that will be on the Station Street site, but that will also be services, primary care delivered services out in the community in a networked and a collaborative and a partnership approach. So I think we really need to reinforce those two pieces of this announcement, the opportunity to be a catalyst and a change for a new healthcare system delivery, as well as the catalyst that the capital project will enable.
I wanted to address that point about what's really different now. As a family physician and across the world, we know that countries that have strong, comprehensive primary care systems have improved outcomes. The Ministry of Health came forward earlier this year and at the end of last year with some new policy papers that are really pushing us to relook at the way we provide care. This whole development is an opportunity to change. And in order to innovate to the degree that we really need to do to provide care in a different way, to focus on primary care and to focus on the patient, we really need to move. We need to think about different ways of doing business, and we need to grow. And that's really the bottom line, is that this is really about patient care and looking at it from a totally different point of view. And we're all very excited at the opportunities that this gives us to focus on the patient and how we serve the patients better.